Доброе утро, меня зовут Ольга Дроздова. Я вас
Good
приветствую.
morning, my name is Olga Drozdova. Let me welcome you on behalf of the Agency for Social Information at our webinar. We are opening our meeting dedicated to the social services provided by the NGOs during the pandemic. I'm going to share with you some technical information, then pass it over to our moderator, Elena Topoleva. We are running our meeting on the Zoom platform.
Спикеры тоже находятся в Zoom.
Our speakers are also on Zoom. In the group for speakers, we consist of 2 levels, and the people who have a status of ordinary participants, you can use chat box.
Выступление закончится, да, мы можем.
When our keynote presentations are over, you're welcome to raise your hands, and we will enable you to speak. We're going to record the meeting, that's why just bear in mind. Perhaps we will publish our findings later on. It's going to be a bilingual meeting because we take part in an international meeting. Therefore, you can use the translation function at the bottom. You can choose the relevant English or Russian channel, depending on your preference, and you can listen to the translation in either of the languages. Let me pass it over to Elena Topoleva for some words of welcome and introduction. Elena, so good morning, dear friends and colleagues. We're all participating in the international meeting, which is very encouraging for us. We are very happy to see our old-timer friends, such as Daniel, Mathieu, and our new friends. Hopefully, we will make friends with you in order to continue to cooperate and interact. Let me tell you that, so actually, genuine Russian winter has arrived in Moscow. I'm sitting in front of my window, and I see snow falling down, so I see just pine trees and typical Russian winter landscape. So the spirits are getting higher and higher, so the new year is coming, and hopefully our life in the new year will be better, more convenient and safer, and we will cope with the pandemic and other serious challenges which we have faced this year. Nevertheless, there is always a silver lining. As we say, every cloud has it. And this is our perspective from the Agency for Social Information based on our activities and events, including days one. So not only authorities, but NGOs and non-commercial sector in general have learned a lot of new things, and we have obtained new skills, which includes not only technical skills and competencies, but some new opportunities for us to do our job in the new formats. During the first wave, when we all were locked down, and now when we are all exposed to the second wave, it's far from being able to do anything we want, but based on the interaction with our Moscow-based colleagues who provide social services, it looks like people are forced to provide their services, but it looks like they are looking for and find the opportunities, and they provide their services in the remote way. So the approaches and techniques they have come up with turned out to be so productive and useful, so that they would continue using them afterwards, after the pandemic is over. Besides that, so distance matters for such a big country as Russia. And we could not actually afford getting people together at one event situated just far away from each other. And nowadays it's possible. Today we're in Vladivostok, tomorrow we're in Kiev, the day after, tomorrow we're in Buryatia. So we get together teleworking these days, and we are able to discuss anything we want. And the organizations which have accumulated vast experience and who have been leading the course in their relevant areas such as palliative medicine or working with children with special needs. As far as I know, they provide very productive methodological support to others who are involved in the same activities beyond the limits of our country. Of course, we provided this assistance before as well, but now we're getting even better at that. Of course, not everyone can actually work online. Those who work with migrants or who provide food to the homeless and who provide assistance to vulnerable groups of people, they can work only face-to-face, in person. And they are facing particular difficulties. Probably we're going to touch upon this issue as well today. Today's meeting is being conducted within the framework of the project, which gained support from the Department of Labor and Social Protection under the government of Moscow. This is the project which we have been awarded, winning in the context which is called Moscow is a kind city. Today we would like to give the floor to Moscow and Moscow-based organizations, as well as those which are based outside Moscow, so that we would share our experience, how we all try to cope with the challenges posed by the pandemic, what we succeeded with and where we failed, in order to understand what kind of takeaways we can draw from the lessons learned, what will help us to get stronger, to be more sustainable, in order to respond to the needs and aspirations of our beneficiaries, those whom we're working for. That's what we would like to discuss here today. Based on the findings of our today's meeting and the previous one, we will definitely work out recommendations for the NGOs and for authorities as well. For instance, the Moscow city government looking forward to get these recognitions from us. So some of those recognitions we have already drafted based on the previously run meeting, but I'm sure that it will be supplemented. The set will be supplemented with the new ones resulting from today's activities. Let me pass it over to Olga, so she will present to you our speakers and participants. I would like to extend my apologies, colleagues, right away, because I will have to leave you shortly, because today's the public chamber hosts the public hearings regarding the draft legislation, which is quite painful for all of us. This is a topic which you are fully aware of. I mean, the law initiative and draft laws on foreign agents. All this will be able to make NGOs' life even more challenging. So, and I'm supposed to actually moderate this session, and I will have to leave you. So it will be actually broadcast on the public chamber website today. So, and you are welcome to join us and support us. Thank you very much for being with us here today. I'm sure that it will be very interesting. And let me pass it over to my colleague, Olga Drozdova. Yes, thank you very much indeed. Yes, as a matter of fact, this is not the first meeting of ours when we discuss how we can work with and for people, how we provide services to them during this challenging times. We have held meetings at the Moscow city and regional, interregional levels, and we thought it would be quite useful for us to get together with our colleagues from other countries in order to discuss how it works in other countries where the situation is very similar, because we're all facing more or less a similar set of challenges, but the decisions may vary because the systems differ. Clearly, we will not be able to cover the whole scope of things today, because this is a topic which could be endlessly discussed, because even those NGOs which work with people and provide services, social service to people, are much bigger in numbers than we are going to discuss here today. But we're going just to touch base on these matters today regarding the solutions available for to be developed, and maybe we will learn something from it. I'm particularly pleased to present to you our speakers. The first one is Mathieu, who is currently a counselor in the cabinet of the Minister of Labor in France. But I'm sure that many people in Moscow and in Russia know him very well, because Daniel used to work in the embassy of France for a long time, and he has done a lot for our non-commercial organization. The next speaker would be Mathieu Strätling. My apologies for perhaps mispronouncing the name. No, by the way, you pronounced his name correctly. So here, Martin is the head of the service to provide assistance to migrants, MiCado. Maria Justiniano is the next speaker, who is in charge of the policy with regards to the elderly people, Global Seniors Organization from Denmark. Skorobogatova, Vera Hospice Center. Victoria Rottenberg, counselor to the Department of Healthcare, the elderly and care at the Diaconic Organization Hessenland. So you'll correct me, please, Victoria, if I'm not quite correctly translating this into Russian. Tatiana Nechayeva, who is the head
семьи благотворительного фонда Downside Up.
at the charitable fund Downside Up. These are our speakers here today. I know that there are many representatives among the participants from excellent NGOs who also have something to share with us. Therefore, while we are listening to the presentations and interventions, please just drop a line in the chat box.
Okay.
And after that, you're welcome to raise your hand in order to contribute to our discussion. And please, if you or when you do not speak, don't forget to turn off your microphones. Otherwise, it will be impossible to translate. Thank you in advance.
Даниэль, сейчас у вас должно все получиться.
Daniel, it should be working out right now, yeah? Yes, I can. Good. Excellent, Daniel, go ahead. Dear friends, dear colleagues, I'm honored again to be invited to take the floor in Moscow, in Russia. I see that other speakers have been facing the pandemic and related challenges. I'm going to share with you very concrete things, how social services are being provided. As far as I'm concerned, I do not represent any organization, even the Ministry for Social Affairs in France. My point of view is just a viewpoint of an individual who shares with you his observations regarding what's going on in his country. And the person who is familiar to some extent with Russian realities, and I assume that it might be of interest to you. Just let me start with some figures. Currently, we have about 1.5 million NGOs in France. And the majority of those work with volunteers. And 160,000 NGOs, over 11%, have some hired employees. Most of them are involved in sports and cultural activities involving hobby clubs and circles of interest. 211,000 social NGOs, accounting for 14%, are the largest ones. They account for maybe 50% of all NGOs' total budgets, and they have the biggest number of employees as well. Secondly, I'd like to share with you measures being taken in France during the pandemic. There are more than 2.3 million COVID positive cases officially registered in France. 57,000 people died of COVID, including 24,000 of those who used to live in the nursing houses. As you know, there are two waves of COVID which we are trying to cope with, which caused lockdown and self-isolation measures. Curfew has been introduced recently in the country. So many have transferred to the teleworking, and many areas of activities have been banned, particularly in the area of culture and sport. Actually, and the respite between the two waves was pretty short, and the activities conducted by NGOs have been suspended or interrupted. Of course, the activities were significantly hampered during these times. 2/3 of volunteers tried to provide remote services during the pandemic, so NGOs have introduced this teleworking modes of work, although some traditional contents have been disrupted. Sometimes other services were provided by volunteers. Museums, cultural institutions, and administration offices have stopped their operations in terms of interaction with NGOs, and 36% of NGOs faced the issues related to comply with security measures, including the availability of the individual means of protection and other measures. Some people among the volunteers were considered to be the group of people who were exposed to particular risks, 21%. So NGOs also faced some economic challenges. It applies probably to all the areas. Of course, people suffered from loss of income resulting from the interruption of activities and events to be conducted. So these difficulties actually continued even after the first lockdown was finished. %67% of employees working with NGOs have lost completely or partially their income, but 26% of the organizations which have the budget of less than 10,000 euros actually incurred losses, sometimes quite significant ones compared to others. Many organizations could actually declare themselves bankrupt. The government provided assistance to NGOs, particularly during the periods when people were temporarily unemployed. So the government provided some salaries even in the absence of working activities. Small organizations are also provided with assistance from the Solidarity Fund to the amount of up to 10,000 euros. They're also provided with an option of deferring the social and tax payments. Another measure which is in the making is related to reducing the rental payments, which is a very important piece of assistance at the moment. Currently, it does not touch upon all those which need this assistance. Some local authorities provide other forms of support and assistance to the NGOs. What I have said so far is related to all NGOs in France. Now let me elaborate on the social NGOs in particular, or NGOs providing social services. They have found themselves in a particularly difficult situation. However, they never stopped their activities related to providing assistance to the vulnerable groups of people. Their volunteers were also able to move even in the midst of the lockdown. They just had to take a line in the relevant documents indicating that they're providing assistance to the vulnerable groups of population. It also applied to people who actually provide services to the dependent people. Secondly, the demand for them have grown significantly. Many people addressed their concerns to the charitable organizations in order to gain some food aid. These were the people who were not known as those who were in need. I indicated that in the relevant columns of ASI, because we should not exaggerate the situation. France did not disappear in poverty, but the pandemic posed serious challenge for the country. But nevertheless, we have to admit that generosity of the French has changed. It's a bit premature actually to draw some conclusions in terms of making conclusion what it will end up with, but nevertheless, the French people take as one of the priorities to provide assistance to those who are in need. Perhaps we will see a return to the most significant forms of solidarity as a result of these processes. I wouldn't say that actually the organizations failed to adapt themselves. On the contrary, they managed to do that. Because they have to deal with the same challenges: poverty, fragility, dependence, absence of relevant and efficient solutions. Nothing has changed for them. And they have to carry on what they used to do, but to work on a larger scale. That's what the social NGOs in France continue to do. They continue to work outdoors and providing services to those who stay at home. They continue to work, but they had to adapt themselves, for instance, in terms of getting the individual means of protection to be worn at all times. It would be premature actually to draw ultimate conclusions from the pandemic and lessons learned, but we do realize that actually vulnerability will not disappear after the coronavirus is won, and the French social NGOs will have to continue their work in order to provide support. But for that, they would need to gain some significant support from authorities, including other forms in addition to financial assistance, in order to be able to resolve the aggravating social challenges. Thank you very much for your attention. Thank you very much, Daniel. Thank you for your overview. I would like to ask a question. We faced a situation at the outset of the pandemic when indeed the demand for the NGOs assistance has grown significantly, particularly from the people who faced a very difficult situation. But the NGOs themselves were not provided with assistance because, first of all, authorities came to think about SMEs, and the government seemed to have forgotten about NGOs. But we started to remind them of ourselves, and we actually insisted on getting support from them as well. And eventually, assistance was provided to us. Did your NGOs have to actually provide the required reasoning to gain some support, or whether the government actually decided themselves that it would be highly desirable to provide support to the NGOs, and they did it without any urging from us? Okay, we will formulate the. Maybe we will actually formulate the question for you in writing, and you will be able to respond to it later on.
Коллеги, я думаю, что если у нас есть вопросы...
Colleagues, I think that if you have any questions to Daniel, please just put them in the chat box. Are you going to stay with us, Daniel? If you can.
Хорошо. Давайте тогда двигаться дальше.
Let's move on.
Переезжаем в Германию.
So we're moving from France to Germany. I would like to give the floor to Martin. Martin Strätling, head of the Integration and Migration Assistance Service, MiCado, Caritas, Germany. Martin, please turn on your microphone. Martin, yes.
It's turned on, you're right. Okay, so welcome from Paderborn, which is a city in Germany and belongs to North Rhine-Westphalia, which is quite the largest federal state here in Germany. My name is Martin, and I'm head and member of Caritas and of our migration services desk here in Paderborn. Let me start with a little problem. So my acoustic gear is not quite working well today, so I hope that I will understand you well, but I promise I will do my very best. The German government promotes the digitalization of counseling of clients of non-profit organizations and NGOs. And today I would like to explain 3 chapters that describe how our government tries to promote our work in these hard pandemic times. So I have 3 chapters which I would like to explain. The first chapter is the so-called Stiftung Wohlfahrtspflege NRW. This is a special This is a foundation that is supported by the state's government of North Rhine-Westphalia. And Stiftung Wohlfahrtspflege offers a special Corona supporting program for non-profit NGOs. The concept looks like the following. The foundation only supports non-profit NGOs, and they should be supported to use digitalized media in order to organize their services as counseling service, but also as other services like work with elder people or young people and so on. The idea is as well to get experiences for the past Corona time, because the experience is that many technical supports and solutions we use in this time could be a solution also for the future. The Stiftung Wohlfahrtspflege wants to prepare non-profit NGOs even for eventually the other social or medical crisis in future, because their opinion is that the COVID-19 crisis probably is not the last one. Maybe we get some other medical or social crisis in future. Their concept looks like the following. They support activities for future-orientated activities in counseling desks and in other supports. And they try to get them solutions for the digital future. They're furnishing NGOs with hardware, software, and even with technical solutions and administration, what means that they even promote the income for some IT specialists who support the NGOs. They offer staff support, and they offer they promote activities for special target groups like elder people, like mentally handicapped people and migrants and others as well. The foundation supports new media trainees for those target group, because we know that it doesn't make sense if only we are prepared and professionalized and digitalized working, but our clients have to be professionalized as well. And they support concepts of digitalized sports and therapy units. And they also support residential area-oriented offers like internet cafes or Zoom meeting spots and living quarters for people with less income and people who don't have a possibility to use IT technology at their own home. The whole advancement is for about 19% of the budget. The minimal budget for an application should be 5,000 euro, and the maximum budget is for about 100,000 euros. So you can realize that they really offer many of financial possibilities in this way. In individual cases, it's also possible to get an amount which is higher than 100,000 euro. Our Caritas organization made an application with a volume for about 100,000 euro. 60,000 euros of this amount will be invested in hardware and software, and 40,000 will be invested in personal costs for IT and administrator and trainers who work with our clients in order to make them fit for the use of digital communicating possibilities. So we have also organized several telephone conference rooms that are prepared with data security based on the European data security law. Within these rooms, it's possible to discuss with clients, but also at the same time with their lawyers or with their mediciners, with translators and other people. The second chapter is the so-called ComAn program. ComAn is a project of KZI, which means it's the Competence Center for Integration of the Government of North Rhine-Westphalia here in Germany. ComOn supports integration projects for NGOs who are working with migrants and immigrants and refugees, but they also support the work of free volunteers in these themes, who engage themselves in the integration of migrants and refugees. In 2020, we got €9,000 in order to organize group offers, trainees, and meetings for our clients and free volunteers. But as you can imagine, due to the corona pandemic, it wasn't possible to realize many of these projects. So we were able to use this amount from ComOn also to buy, for example, 4 laptops in order to organize the Zoom meetings and trainings for our target groups instead. The reach number of these persons is less, of course, but this is accepted by the government in this year, also in the controlling programs. So they accept that we have for about 20% of reached persons less. And this is very important for us because, of course, it's not possible to reach everybody on a digitalized base. The third chapter I would like to introduce is the so-called MBE. MBE is a regular supporting program of the federal government of Germany. And it's a program in order to counsel adult migrants who live in Germany in the first 3 years of their residence here in Germany. In our desk, we have for about 400 clients and offer around 1,500 counselings every year. In 2020, it was quite, of course, difficult as well to meet these clients. In many cases, we need translators. So in these cases, we are 3 and 4 persons in one room, and this is, of course, not possible while the hard lockdowns. So this makes important and necessary discussions impossible. The federal government offers us as well €9,000 in order to organize digital meeting rooms. This means our clients are able to use a separate room and the digitalized gear in our counseling desk and can communicate with our social workers by Zoom or Big Blue Button systems. So we were able to invest in hardware for the digitalized workplaces, even in home office as well, and into telephone conference rooms. Our conclusion all around is that we really did good experiences with these new conditions of social work in pandemic era. Many administrative orientated counselings happen faster, which means this is also a positive factor for our time management. But in cases of crisis interventions for mentally ill clients, for example, or in cases of family-orientated counseling, there's still a need for communication face-to-face. So this point is unfortunately not not solved yet. Maybe one last information. Our federal government plans to accept costs for video conferences as a tax-deductible factor probably. So we hope that we will be supported in this way as well, probably in the next year. So that's it for the moment. Thanks for your interest.
Martin, thank you very much indeed. First of all, thanks a lot to you for your work, which is very important and valuable. We keep talking about digitalization, how we all migrate online, doing our work, but not always, or those who are actually potential recipients of our assistance are able to get access or accept our digital information. And here in this country, many people also face lack of financial resources for providing teleworking, and smaller size regional NGOs also complained about that. By the way, we ran a survey in the public chamber, and the NGOs keep saying that they lack themselves hardware and software and required competencies and skills in order actually to migrate and move to the digital format of work, which is sometimes the only way to move forward. So that's why we understand very well what you were talking about. By the way, I already mentioned the measures of support to be provided to NGOs, and they were accepted eventually, and they were provided by the government and by non-government charitable funds, private ones, which started providing assistance to the NGO affected by the pandemic, primarily to those who work with and for the vulnerable groups of people. But NGOs actually request to have a special purpose program for providing support to digitization process in order to help them. And this, unfortunately, we don't have this special purpose program yet, but hopefully it will be provided soon. Who is the next speaker, Olga? I would like to ask whether Daniel is available to answer the question. So it's going to be provided in the chat box. I would also like to remember that you're welcome to ask questions to our speakers.
Да, у нас есть еще такая вкладка.
Either placing them in the chat or later on. We also have a section for Q&A, and you're welcome to use it. I have a question to Martin, by the way, regarding digitization and means of communication.
Не все люди готовы.
Not all the people are capable of using the internet facilities, or they do not have access to the internet services, or somebody is not able to do it or doesn't have access to it. I would refer to an example in the city of Penza. We have a civil union foundation which works with the elderly people. And when those elderly people were actually locked down inside their houses and apartments in spring, and they were just going mad because of loneliness and their lack ability to communicate with people, just to smooth it a bit, they actually decided to buy just a set of old-fashioned and simple in use and friendly in use mobiles, and they just actually help them to call each other as the elderly people used to do it. But they could do it only at the expense of some volunteer and privately provided assistance exclusively. Do you have any similar solutions? Does the government, do the authorities actually support this kind of initiatives? This is a question to you.
Oh, I'm sorry, I didn't get this as well. Could you repeat once again, please?
Хотела спросить, как...
I would like to ask you the following question. When beneficiaries do not have access to the internet services, are there any alternative means of communication for these beneficiaries? For instance, telephone means of communication or others, which might be supported by the authorities, because we had this kind of experience, but it was a privately supported initiative, not the government supported one. Is it clear? Is the question clear, Mathieu?
Yeah, I think so, yeah. Of course, we're also trying to reach our clients by telephone or by WhatsApp or other media. So the main important point is that we just have to see how we can reach these people. The biggest problem is not the communication as its own. The problem is that we don't know exactly which kind of technical support the other side has, so our clients have. That means that we try to use, for example, this telephone conference rooms, which are supported by the government as well. But there are still even situations where we do have to contact our people face by face. What means that it's very simple, but they come to our counseling desk. They're staying outside outside the building, and we are talking to them face by face through the window. So now we have winter times that makes it very hard for them to stay, but even in summertime, this was a solution as well while we had the first lockdown. But there is still no support in order to use, for example, telephone conferences, with the exception of these telephone conference rooms we use. But that's the biggest problem we still have in Germany, not only in kinds of social work of NGOs. For example, we have the problem in schools, so the pupils are trained in lockdown from tomorrow on as well, in homeschooling, and many even of those pupils who are living in families with less income, they do not have the possibility of use compatible hardware. So this is still a big problem. No? But as I try to explain, so what we are trying to organize and what we still organized in some areas is that we try to use some internet and Zoom meeting points in living quarters of those people who are our clients as well, so that they will be able to go there and to use the gear there in these meeting points as well. And this is supported by the government as well.
Спасибо. А вот последний вопрос, такой же, какой мы задавали Даниэлю.
And the last question, similar to what we asked Daniel. Did the government provide support right away and came up with this kind of initiatives? Or did you have actually to make your case and to prove the necessity of providing this particular type of assistance before the government? Or did they respond immediately themselves, realizing that this is something which people are in need?
Yeah, both is happening as well. So when I explained the providing of Stiftung Wohlfahrtspflege, for example, they are offering us a concept, and we can make an application. In other cases, we have to contact the governmental organizations from our place on, because we have to explain that it's difficult for us to reach our clients and to do our job and try to find a solution. And in these cases, we have to give them a concept and they decide whether they will follow or not. So both is happening.
Спасибо. Я вот зачитаю.
Thank you. Let me read out the response given by Daniel in response to the question posed by Lena regarding assistance provided by authorities. Daniel says that assistance to NGOs was provided right away because authorities try to rely on them in order to reach out to the vulnerable groups of people. And of course, support depends on the number of employees, not on the legal status of an organization, which includes NGOs, self-employed enterprises, and the like. Nevertheless, many NGOs suffered economically. For instance, again, those who operate in the area of culture, because their activities were suspended. Okay, thank you very much, Daniel. Thank you very much, Martin. We keep going and we are moving to Denmark. I would request Maria Justiniana to get connected to us, Global Seniors Organization. We're going to talk about how elderly people who turned out to be in a very vulnerable situation everywhere in Europe, Russia, and everywhere. Maria, please, the floor is yours.
Good morning. Thank you very much for this opportunity to be in this conference. first of all, I would like to say that the situation of COVID in Denmark is now getting more serious. The number of cases is rising in spite of some hard measures that were put in place 2 weeks ago. So now the majority of the country is partly in a lockdown, where schools, museums, restaurants, cinemas, bars, etc. are closed. All shops are open, and we're also allowed to leave the house without any kind of permission. So in that sense, we are not so bad off as many other places. And also the government is providing financial support to various companies and enterprises in order for them to be able to survive through the pandemic. And also the cultural life and the NGOs receive some support. As it was said in the presentation, we'll focus on the situation of older people, and I will do that from a perspective of being an older person myself and a member of this organization called Global Seniors. We have in Denmark 2 very large organizations organizing older people, and then we have our small organization, which is called Global Seniors. And it's called Global because the majority of us are people who have been working with international issues or are interested in international affairs. So we do we organize meetings for our members about global issues like climate change, globalization, and the sustainable development goals, to mention a few. So during the lockdown, these meetings have not been possible to conduct. So that we have tried to organize some of them on Zoom, but not all our members have been quite able to use the technology. So there's a challenge there. But in Denmark, as on a whole, but we also do some advocacy regarding the rights of older people. And that's how I think we have come into contact with your organization. The cooperation in Denmark between the state and municipalities and the CSOs with regards to older people has been relatively smooth. In the beginning, the discourse of the government and everybody was very much about protecting the older people from getting sick from corona. And there was also fear of getting the virus spread into to nursery homes, because older people living in nursery homes, they have been denied visits from their families totally, especially during the lockdown in the spring. And they tried to introduce digitalization at the nursery homes, but not everybody could benefit from that. For example, older people with dementia, they simply didn't understand that they didn't see their usual contact, their wife or their husband, but only had to look at a screen. That was quite, I think, a problem at the nursery homes. And so as the pandemic progressed, the issue of isolation was brought very much forward by the organizations of older people. And it actually virtually turned into a battlefield between the staff and the unions and the relatives and the older people and the government about the restrictions for visits, because it was said that it's not only a question of physical health, being sick from COVID, but also a question of social and psychological issues. Sorry. Today, it's allowed for one person at the home for elderly people can receive one person to visit, only one person, the same person all the time. You cannot sort of change the contact person, but you can. But in some places you can have two people that can come and visit in a specific room that has been assigned for visits. So the discussion has been quite heated in this area, and but it seems like the government has really listened to the organizations of older people in this regard, that they have now loosened a bit the measures. But I also hear that in some homes where there has been outbreaks of corona, now everything is locked down and no visits possible. And then, so those are the people living in nursery homes. Then there are also a large group of older people who are actually the biggest group who are living at home on their own. And some of those older people, they are really afraid of getting the disease, the corona, and so they have actually isolated themselves for a very, very long time. They haven't been outside their homes, and this group may be the real losers, because they have not seen any people for a long time. There have been some attempts by organizations like Red Cross and others to set up, like they were also talking about it in Germany, to set up visiting friends on the phone, so that older people could be connected to somebody who would call them on a daily basis. And there has been a very big number of volunteers signing up to do this kind of work, both with older people and also helping them to do shopping and so on. But the large group of older people who are sort of more resourceful and who do go out during outside their homes, they have also suffered, because the normal activities that they have been doing, like walking groups or visiting each other and so on, they have all been cancelled. So there's a big concern about the situation of the older people in Denmark. So there are many different voices about this issue, and also virtual aids have been taken into use. For example, as I mentioned, on the nursery homes, the Skype or other things have been used for older people. But also, some organizations have received financial support to carry out or to organize virtual study tours, for example, to other countries. And lectures from professors and so on online that you can attend for free. So there are a whole range of different efforts targeting different groups, but definitely there are some people who are not able to to benefit from these, but then there's another group that are that is able to benefit. So I think I will end here all for now, and thank you for your interest.
Спасибо большое, Мария, за ваш рассказ.
Thank you very much, Maria, for your overview, and thank you very much for your very important work you have been carrying on. In this country, practically all the NGOs are also concerned about the elderly, because the elderly people, particularly those which are in these institutions of all kinds, happen to be in a very difficult situation. And we realize that at the very beginning of this pandemic, and our NGOs initiated what we call the letter of the four. Anna is smiling. So the founder of the head, actually, the Hospice Assistance Foundation, and the founder of the Vera Foundation, she initiated the letters signed by 4 federal ministers, which was about the following: even during the pandemic, the social institutions for the elderly should not be completely closed for the NGO people and other volunteers, because despite all the protection measures, we should not forget about actually deteriorating quality of life of those who stay in the nursing homes. And our NGOs keep actually alarming everyone about this status of people who live in the institutions, to make sure that the quality of the life would not deteriorate tremendously when the people are unable actually to go out or to communicate or contact anyone. So access is allowed for volunteers, but still there are sometimes very serious challenges arising with regards to some particular places and locations and institutions. And many staff at NGOs and social service employees during the first wave of pandemic actually took some people to their homes to enable them to live with their families, particularly those people who suffer from disabilities. And it applied to both adults and children. And they took them to their homes, and they actually couldn't return them afterwards because they got used to them. They actually loved them as their family. So, and they actually didn't part with them after that. So there were many instances like that. Olga, please. There is a question from our chat to Maria. Thank you very much for the very interesting presentation, and good luck to you in your endeavors. And the question is as follows: do you work with the elderly who have disabilities and autistic related issues? It's autism, about autism, because very often people who have autistic children cannot actually ensure lockdown measures, and they have to leave their premises. Do they gain any special purpose support in Denmark? Suffering from autism, do they gain any special support because they have special needs? Did you get it?
Yes, I got the question. I honestly don't know, but if you would like to know, I can try to find out and send the answer to Olga. Sorry.
Хорошо, Оля, ты тогда вышлешь тем
Okay, thank you. And then Olga will just resend it to those who posed the question. Okay, thank you very much.
Thank you.
Okay, let's move on. Colleagues, if you have any questions, please place them in the chat box and we will definitely try to answer them. Let me pass it over to Anna Skorobogatova, the director of the Hospice Assistance Foundation, Vera. So we are actually getting to the topic which is related to the people who need support being in the institutions and people who stay in their homes. And sometimes it's impossible actually to provide assistance online. And with reference to my own family experience, I know how important it is. And actually, this kind of help and assistance could not be interrupted because it's impossible. Anna, please tell us how you are currently working in the given circumstances, what is changing. Thank you, Olga. Let me welcome all the participants and guests. Lena, Olga, thank you very much, not just for being able to join you and share with your experience, but just for the very fact that we can get together in order to discuss not just what the Russian NGOs do sharing their experiences, but we can also take a look at what's going on in other countries. And I'm very pleased to listen to Martin and Daniel and Maria's overviews, and to a larger extent, it actually corresponds to what we have been doing here in this country. Just half a minute to remind you of what our foundation is doing. So it's well known in Russia, but just for our international colleagues, our fund has been operating in order to make sure that everyone who is terminally ill in Russia would get some decent palliative assistance at the end of their life. That's why we provide systemic assistance to hospices, patients, and medical staff. We provide families who have terminally ill people in the regions of Russia, because there are very few children-focused hospices. We actually develop and promote volunteer support for hospices. We actually even published some methodological recommendations that we help to provide training to doctors and nurses. We have a hotline free of charge for relatives, for families. We have a huge portal on palliative aid to be provided, which is particularly important during the pandemic and the lockdown. So we are focused not just on the very person who is terminally ill. It's not the only one. He's not the only one who has been the focus of our attention, because it deteriorates the quality of the family life in general. And of course, we had to review our programs in relation to COVID, and it affected our work. But in order to talk about it, let's take a look at how the life of people who are beneficiaries has changed since the last spring. Speaking of hospices, it became more difficult actually to find a place in hospices, because many of them were actually reprofiled, reformatted in order to treat only COVID-positive patients. Those who actually turned out to be in hospices were completely closed for relatives to visit. And Maria was telling us what kind of difficulties the institutions faced in Denmark. It's exactly what we experienced in this country as well. So, and the quality of even medical assistance deteriorated because of these restrictions. Another important point, many family members turned out to be just on their own with their terminally ill members at home, very often without any support. They actually canceled some hospitalization and surgeries, and the number of visits dropped, and actually turned out to be particularly clear how important the assistance at home is. So actually the visiting medical care turned out to be particularly important. Actually, we bought some vehicles in order to provide transportation capacities for those who are providing this visiting nurse care. So, and sometimes parents could not get access to the resuscitation wards where the children were placed, and we were trying to submit letters to help parents to be allowed actually to stay with their children in the resuscitation wards. And how did our work change because of all that? It turned out that we as NGO, to a larger extent, are more flexible and mobile than the government, because we are not bound by the law on state procurement. And when the security measures actually took the front and we realized that we need to buy individual protection means and sanitizers for the institutions, even Moscow-based hospices actually needed our assistance, because we know that the Moscow-based institutions are provided decently with all medical means. But the machinery of the state procurement did not gain momentum. So when the auctions were going on, we already managed to find resources and to organize new procurement programs. Our partners helped us to take care of patients and medical staff as well. We had several programs focused on actually providing transportation services free of charge for the medical staff from home to work and backwards, in order to alleviate the workload on them and to minimize the risk of contracting COVID using the public transportation means. So Martin was talking about socialization of these services, and we also moved in this direction. We also bought tablets, and we also ensured online communication lines amongst those who were among the hospice patients and their parents. Of course, not everyone was capable of using these tablets, of course, as Martin also mentioned. That's why our coordinators and nurses tried to teach, train, and assist. And since volunteers were not available at the time, so the medical staff assumed additional workload actually to provide this kind of services, just to carry on this digitization story. So we realized that we need to provide en masse support to those people who stayed at home, just face-to-face the terminally ill people. So, and we provided all kinds of instructions how to take care of the ill people. So, and we published materials regarding the of legal nature, how to provide support, and we provide a lot of materials about psychological support to be provided both to the patients and the relatives. Speaking of training, indeed, we had many programs offline, and our partners and the palliative assistance center and other partners, we all had to actually reformat and reprofile our work, and we had to transfer our work from offline to online universe, and we migrated onto the online space. Of course, it was a new challenge for us, which actually required amending the programs and new technological solutions. What was extraordinary among those which we faced, which we experienced these days? So business support, which was enormous. Actually, pandemic caused creation of new partnerships. We were actively provided, not only us, but others were also very actively provided by business, and it became particularly obvious how we need each other. On the one hand, there was business which was ready to help, and on the other side, there is a medical institution which needs this support, but business is not very capable of cooperating with hospitals. That's why many companies who were ready to provide assistance, they were looking for a partner who could be charged with the task of providing this support in the area of social responsibility mandate they had. And I think that this is one of the conclusions we have to draw. That's what we need to develop. That's what we are going to actually develop, among other things, in our portfolio. What is ahead of us, and what should we be prepared for, and what kind of lessons could be learned from this kind of situation? First of all, it's quite obvious that assistance at home to the terminally ill patient is extremely important, and we critically need to develop a system of providing support at home, the system of visiting nurse care all over the country. Volunteer support at home is a standalone issue, which is also quite important. It is quite a challenge. There are many subtleties and nuances related therewith, and I think that one of the most important things is about trust. Trust in the person who comes to visit a fragile patient. Another issue is how to engage local communities into all this. We came to think about it, and we're going to develop it next year. So fatigue of medical staff is growing, and emotional burnout of these people is going to be another challenge for us next year. We continue providing support to the institutions and to the medical staff, and we keep thinking about how to develop this program. Speaking of the hospice type of assistance, of course, COVID and lockdown actually brought us back this year. So Martin was telling us about actually interruption of communication with some volunteers, and we faced the same challenge because volunteers and coordinators were also in charge of developing this volunteer relationship, but we do not have volunteer support on the scale we used to have in the past, which puts another additional workload on the medical staff. But the hospices are being opened gradually, of course, subject to compliance with all the social distancing and other individual protection measures. Volunteers start coming to provide some sort of assistance, and next year we are going actually to find the right balance between the medical and non-medical ways of providing assistance to the patients. That's what I would like to share with you very briefly here today. Thank you very much for enabling me to do it. Thank you very much, Anna, and thank you for your continuous efforts and even further working on that. And you keep working in these very challenging times vis-a-vis new challenges and finding new solutions. It's quite interesting what you mentioned, that you have become a corporate and social responsibility program operator. So it actually, I found it quite interesting in particular. Do I take it correctly that during these times, the companies, many companies decided to provide more assistance in the area of palliative aid, and you organize this program for them? Or is it something else? It includes both palliative and non-palliative aid. Let's take Moscow Exchange, for instance, which traditionally supports us. This year, the Moscow Exchange decided to provide several foundations. We got some donations to the tune of 30 million rubles. Some of this funds was used to provide assistance to the regional palliative institutions and hospices in particular. Some of these financial resources were provided to provide assistance to just general profile hospitals. We just launched an urgent program because it was also in high demand. Thank you. It's quite interesting. Thank you very much. I think the messages keep coming. So Daniel is giving an answer regarding the organ suffering people. And there were some measures made in France to ensure self-isolation for the families having people suffering from autism, and they actually published several methodological recommendations how to survive together with a child suffering autism, and it was provided by the resource center, and we're going to have a link to this kind of recommendations. I saw a question from Yulia Bogdanova as well. It was a bit higher. I'm going to actually replicate it. so that everyone would see it. Yes, there was a question from Yulia regarding the government support. Maybe we'll ask this question when all our colleagues from Europe finish their interventions. Before pass it over to Victoria, I would like to get back to Martin for a moment. He provided comments in the chat that his organization also has had some experience of dealing with people suffering from dementia. Is it correct? Martin, are you ready to share your experience?
Yeah.
How you worked with people suffering from dementia?
I would just like to share one rather private experience, because we, Caritas here in Paderborn, are also offering a dementia center where for about 60 people with dementia are living in. And my mother is living there as well for about 2 years now. So our experience with her was that in the first lockdown in spring, we tried to share to meet her by Skype, and this was quite a good idea. But the problem was that she didn't realize that we were in personally, so she thought it was some kind of movie. But the positive effect was that something was happening. So she was regarding us. She was she got into contact to us, even if when she didn't understand what really was happening. But something was happening, and our experience was that C-19 crisis is only one of those many crises these elder people have gone through, and they try to explain the situation by themselves. So when we were talking with her, we realized that she always has an idea what is happening and why we didn't see us for such a long time, and why everybody who enters the center is wearing a mask. She didn't understand this, but she tried to find her own answers. The main problem of these demented people is that they depend on physical contact to their relatives. They have to get a physical contact, to be touched, to get a kiss or something like this. And this is not happening while lockdown times. And this is the real hard situation, because their intellectual capacities are going less, but their emotional capacities are going up. And so we have to try to get into contact with them, not by communication and first, and not by talking about some things in first, but we have to get into contact with those people by emotion, by physical contact. And this makes it really hard at presence for them. I just wanted to explain.
Да, спасибо большое, Мартин.
Thank you very much, Martin. Colleagues in the chat keep writing that indeed there are more demands for psychological assistance. We observe it with regards to practically all the groups and categories of people who actually live and survive through this situation. It applies to those who are among the vulnerable group people and those who seem to be actually in the group of ordinary people who keep working, but the situation has changed to the extent when all people need psychological, psychiatric, and psychotherapeutic assistance. And it's on the rise, and it's probably going to be one of the most important vectors to be taken on by all NGOs and all those institutions which provide support to NGOs who will have to assume this additional piece of work in order to provide additional support to the staff of the organizations which are depleting their resources, who will have to deal with this without seeing the end of the process. Let me pass it over to Victoria Roterman, who is a counselor in the department Health, the Elderly Care with the organization. Let me correctly pronounce it. Diaconic Gessen. Victoria, help me, please, help me out. How to correctly name your organization, because this is probably a system which is not very well known in Russia. I will be pleased to do it. Don't be surprised. I speak Russian because I was born and raised in the Soviet Union, so that's why I'm taking an opportunity to actually tell you about my work in Germany and Russia. Good morning, everybody. Good afternoon. My name is Victoria Rottermiller, has already introduced me. I work in the Diakonia. What is this? This is the social service of evangelical church, which provides services and provides care to people from their birth up to their old age, as we say in Germany, from the cradle up to the palliative and hospice-based assistance. I work at the federal level. The Diakonia Hessen. Diakonia Hessen is an association, and NGOs are among the membership of this organization to cover various areas of activities. These are the institutions which provide services and support, consulting services in the area of education, training, skills upgrading. They work in the area of dealing with youth, families. They also provide assistance to the disabled people, elderly people. They provide assistance related to integration and provide counseling services to migrants and refugees and people who happen to be in special social situations, which would include homeless, unemployed, impoverished people, and the like. So there are about 42,000 working in total in this organization. And the task of my department and the task of my colleagues is about providing support and consulting services to our membership organizations, working in the area of health, and providing care services on a long-term basis, on the one hand. Provision of services to the needy people, which of course, first of all, include the elder people, people living in the nursing houses, and those who need the visiting nurse care at their homes. In total, we have about 400 organizations of this, little more than 400 in Hessen. Among those, and the number of staff working in these organizations account for 13.5 thousand people. On the other hand, as an association, we cooperate very closely with other similar associations and charitable organizations, such as my colleague from Caritas. So we are similar associations or communities, but this is from the Catholic Church, and we act on behalf of the Diaconic Church, and we cooperate very closely at all levels, meaning at the federal level and other levels as well. We cooperate with Caritas. Of course, we cooperate very closely with this type of organizations and associations as well, with the authorities and political forces at all the levels, including regional, land, and federal levels. We are an NGO, of course, non-commercial organization, but we try to work at the high professional level. Organizations providing care services to the elderly people have to comply with some legislative requirements. Their work should be organized to meet the legislative requirements, which includes regulations in terms of relevant qualification level of staff. It's all regulated by the social legislation of Germany. As for the pandemic, in particular, that's why we're all here today, actually. COVID-19. As for the first wave, the colleagues have already mentioned, colleagues from France, Denmark, and Germany, Martin. The first wave hit us in February. The complete lockdown was imposed on the 16th of March. It applied to the nursing houses as well, so they were shut down for visiting. Of course, the provision of care continued for those people who stayed there because this is their home place. It's not about an organization which is just closed and lives its own life. No, this is a place where people live. This is their home. And they just move there to live, getting old. And of course, in one place, there is a big number of the elderly people, and everybody knows that they were among those who are qualified the notion of a risk group. And of course, relevant sanitation and hygienic measures were supposed to be introduced to protect them from the infection to penetrate the walls of the house. The outpatient services format has changed as well. Involvement of personnel has changed. Many people had to move to their home offices, and family members had to learn how to take care of their elderly relatives, moms, grandmoms, and granddads, which actually facilitated the outpatient services actually to engage the staff where it is mostly in need. As Anna mentioned, so when people stay at home, it's quite a different type of isolation when a person is isolated at home without getting access outside and without people who provide assistance to you are also deprived of access. Outpatient services also have changed. I did not actually notice any panicking in these institutions because everyone was properly prepared for that. And these institutions are subject to continuous checks and inspections to ensure quality of their operations, and there are relevant plans related to pandemic response measures. The World Health Organization provides relevant guidelines, and it was all well known to our services since they are professionals in this area. As for financial support, so the government support was provided to the institutions providing long-term aid and long-term care. The law was introduced providing for that all the expenditures and over expenditures related to pandemic from March of 2020 and up to March of 21 would be compensated from the so-called social insurance funds. That's how it is called in German. All these costs and expenses would be compensated with the aim of not allowing a collapse in providing services, vital services to the elderly people and to the people who need this kind of services. On our side, as an association, we also introduced all forms of counseling and transfer of information to our membership organizations, which would include daily info mails and and for bulletin on our internet sites and teleconferences, as Martin mentioned, they got available maybe just during the first or second week after lockdown was introduced. Our video conference communications in all 16 lands of Germany actually took and continue taking place on a weekly basis to enable us to share our experience in order to jointly draft and work out some concepts altogether, so that there wouldn't be any need to reinvent the wheel. The wheel has already been invented and we can make use of this. Yeah, this is the Russian translation of this idiom, to reinvent the bicycle, as we say it in Russian. As if I recollect from my Soviet Union life, those used to be sanitary and epidemic control stations. So we have similar organizations which work on the ground, and which should be the first point of contact in terms of the COVID or other epidemic response measures, if anything like that arises, particularly among the patients or staff of the nursing houses, or if the same is observed in the outpatient facilities. Bonuses were provided to all those who work in the area, providing care and other services to the elderly and vulnerable people. And so they took scope and stock of what was done, learning from the lessons of the first wave. It applied to people suffering from dementia. It was clear right away that complete isolation was not a relevant mechanism for them. So, and Skype doesn't always work for them. Even if a person sees a relative, he or she cannot always understand what goes on. So there is no way actually to touch a person. There is no tactile contact opportunity, which is critical for people suffering from dementia. So, and we ran surveys amongst the elderly people and the staff, medical staff, and we concluded that we do not have just tremendous outbreaks in the houses, but as you mentioned, the lockdown caused some psychological problems amongst the elderly people in particular. So actually they started to move less, and the bed sore became a real issue. And Maria also mentioned that the elderly people could not get together in a group and to walk together somewhere in the park. It also had some consequences. So, and of course, we need to include into the scope actually the moral related issues and legal related things, what can be allowed from the legal perspective, what cannot be allowed from the perspective of ensuring rights and freedom of people. As for the second wave, in between the two waves, of course, there were some concepts developed to prevent isolation measures for the elderly people. In case of the second wave to come, there were some guidelines developed, methodological recommendation to prevent and treatment of COVID-19 in the institutions for the elderly people and the institutions providing care. to the elderly based on the new knowledge related to the pandemic. And during this respite, we took advantage of providing the institutions with all the sanitizers and individual means of protection to the houses. So all staff are trained how to do this rapid test operations to detect antibodies. All the staff and the institutions are probably trained on that. So when testing is provided based on the individual plans developed by the institutions themselves. And currently we're getting prepared for the vaccination campaign. So on Sunday there was a conference held, chaired by Chancellor Merkel, and the total lockdown is going to be announced tomorrow. And what is ahead of us, probably we will get back to it a bit later after we all participate in the general discussion. Thank you very much. Thank you, Victoria. Colleagues, please formulate your questions to Victoria. Before passing it over to Tatiana Nichai, I would like to focus your attention on the following. Martin comments again that many beneficiaries and the organizations work for and work with have some experience in living under the lockdown arrangements, and Martin is just indicating that they ran a survey regarding to draw lessons from this experience, accumulate how could it become handy now, and it would be quite logical to pass it over to Tatiana Nichai, who represents the fund Downside Up. Our society in Russia is not sufficiently inclusive yet, unfortunately, and when in spring the lockdown measures were introduced, we did not actually announce it as a full-fledged quarantine or lockdown. We call it self-isolation. We were not allowed actually to move around without having relevant permits. It was similar to more or less to how it was arranged in Europe. And people actually mentioned that people with disabilities actually, they live in this way for a long time. And now we experience similar things. So, and we need to come to think of how to address it. And I would request Tatiana to tell us how the Downside Up Fund works with the families working from the Down syndrome, whether the young people or adult people, because the fund has been growing. So they started dealing with children mostly. Now the children are grown-ups and respective challenges have grown up as well. Tatiana, please, the floor is yours. Thank you, Olga. I'd like to welcome everyone. My name is Tatiana Nichayeva. I'm the director of the charity Downside Up. As Olga has mentioned, the fund provides psychological and pedagogical support to the families containing family members suffering from the Down syndrome at various ages. So the fund has been operating for 23 years, and the supported families residing in various regions of Russia are covered by our services and support. So all the support is provided free of charge, and we can actually provide assistance to other families thanks to the financial support received from various sources, including the government grants, private fund and commercial companies fund, and private donations. And during this challenging pandemic times, as many have already mentioned, we also gain support from all these sources, and we are very thankful for paying more attention on the side of the commercial organizations and on the sides of grant providing government authorities who demonstrated their loyalty and understanding and initiated some amendments to the mechanism of providing grant support during the whole period of our existence. The fund found it very important actually to keep on maintaining the family-centered support approach, and during the pandemic it became particularly obvious and important for us because we did understand that children, adolescents, and adults suffering from the Down syndrome found themselves in the even more severe isolation situation, being under the pressure shared by the whole of the society, public at large. And we tried actually to maintain the focus on clear understanding of all the needs experienced not just by the person who suffers from the Down syndrome, but by all the family members. As many speakers mentioned before me, it was particularly important to provide psychological support. And this is the area of our activities which we keep developing and maintaining all the time. As a matter of fact, we have been working not just with the families where the syndrome affected members are already there, but families who are actually expecting a child to be born with the Down syndrome. And this category of families also turned out to be under extremely stressful situation. Therefore, all the formats to provide pedagogical and psychological support was actually translated into the teleworking formats, and we managed to do it, and we're very thankful to our IT and GSU people who actually made it possible to happen. We turned out to be extremely lucky in the sense that we have been working the remote format of providing support to the families for many years, because we provide support not only to the Moscow-based but to the regions-based organizations as well. We have e-library which has been functioning, which collects more than 3,000 pieces of recommendations of all kinds and various formats to the children, which includes video materials and stories which tell the story and experience of the families. And we were working on how to restructure this e-library. We had a counseling forum to enable provide support from relevant experts, including people of various medical specialties. So we provide all kinds of tele support, including telephones, internet, and others. And we were trying to keep providing this kind of support and to develop them further, because as it has been mentioned, the families in Russia vary very much in terms of their capacities. And some people can actually make use of the video communication lines by WhatsApp or Skype quite actively. Some people can use broadly the internet capacities, but there are families which do not have this kind of abilities or cannot afford it. So, and beneficiaries actually also refer to it. For instance, there is no sufficient number of gadgets for all the family members because children do their classes remotely, and it was families found it quite difficult to find additional resources actually to supply all family members with gadgets. And internet utilization sometimes is quite expensive because this kind of regular support could be quite massive. And the telephone communication support mechanisms, as has been mentioned, are also among the tools we use. If we cannot make use of the internet tools, we use the telephone communication lines. What kind of objectives are we setting for ourselves? As I have mentioned, psychological support to families, not to parents only, but all the members of the family, including siblings and the adults, people suffering from Down syndrome. This is our specialization, actually, online support groups with the adolescents and young adults. And it happened that since last year, we started very actively preparing our youth above 16 years old how to learn the internet space and how to make use of it. It turned out to be very helpful to maintain contact with them during the pandemic, and the medical experts could contact them directly, not just via their parents only. Also, during the pandemic, we put particular emphasis on providing support to parents in organizing everyday activities for Down syndrome suffering individuals. We try to find a balance between the academic studies and classes offered to the youth and just those forms which are rather in the area of everyday activities. It's very often that we observe that people who turned out to be just on their own with their children during the lockdown period, so found it very difficult actually to organize time and space for a child and for the family in general. We all understand the families live in quite various houses. It's very often just a small apartment which is shared by parents and children and the grandparents, and of course it makes living psychologically very challenging when people have to stay close to each other continuously. Therefore, pedagogical experts and other experts try to provide some real life advice to ensure keeping active life for all those who live within this limited space. It was also very important for us to discuss vis-a-vis families and adolescents some life planning prospects. One of our face-to-face professional orientation program for young people, adult people, was quite helpful, and we try to actually maintain it in the virtual space, because one of the concerns referred to by adolescents and the parents is their lack of understanding what is ahead of us, and they fear the future. And it was very important for us actually to tell them that the life prospects should be maintained, and we have to discuss their plans and their dreams and what the youth would like to have and how they would like to live when there will be more social opportunities provided to them. And as I said, we tried to make sure that all the family members would get involved in anything we could. And thanks to our partnership fund support, which is called Syndrome of Love, we engaged online volunteers who offered all kinds of master classes for all age groups suffering from Down syndrome, so that everyone would get engaged and involved in that and to gain something useful for them. We also conducted remote classes, which was kind of a reflection of our face-to-face classes. As one of our moms mentioned, it was actually home delivery of Downside Up services when children and parents were sitting together in front of their screens, taking part in the teleclasses. And these are the formats which we have been maintaining now. And we try to be very careful and scrupulous about the contents of these classes. We do not want at all to face a situation when parents will have to force their children actually to sit in front of the computer display and spend time watching the classes. we want to make sure that children would be interested and motivated. We are trying to apply a whole variety of approaches and various components, which would be training classes on the one hand, but on the other hand would be of interest and responsive to the children and parents' needs and interests. As I've said, it's very important for us to ensure very active interaction with parents. Whatever we do, let it be a psychological online group or individual counseling of experts on WhatsApp, it is based on the expected feedback from parents. It should be a dialogue. And as a matter of fact, it should be actually a cycle of interactions when it could be initiated both by the trainer or by the parent, but which would imply actually exchange and sharing feedback and ideas. And this kind of remote approach is more time consuming on the expert side, particularly as far as the psychological resources are concerned. What we are trying to organize and introduce is psychological and methodological support of our staff to ensure prevention of professional burnout and to make sure that those people who are providing support would be supported themselves on a timely basis. I'd also like to tell you a little bit about another quite important experience we gained during the pandemic. We tried to organize meetings which we call parent to parent, for parents to share their experience. This is a principle when a parent could feel what it means actually, not a recipient of the support, but a provider of support as well, which is very important from a psychological perspective because it instills confidence in a person, helping to find more resources, internal resources for him or herself. And similar approach we try to apply to adolescents and adults with the Down syndrome, so that they would feel not just as recipients only, but those who create something as well. And our online creative workshops were quite actually operating. And in the course of this operations, our children actually created their own materials. We had very interesting projects out of isolation. Actually, you are all aware of that. It was quite an interesting period of time. And we had a project which is called Poetry for Pushkin and Poetry for the Victory Day, when the children actually were reciting their poems. And these projects grew into quite beautiful ones. If it's of interest to you, we will be pleased to share these projects with you, or you can actually find this on our YouTube channel. In June, we ran an online festival, which is called Various Facets. There were 11 creative groups from 9 regions of Russia took part in this online festival, during which all these creative groups, children, the adolescents themselves actually presented their work, and it was very exciting and was very emotionally moving for us, because we did feel that all our efforts focused on creating and strengthening this regional community resulted in something in which we continue to develop for many years ahead, as I hope. Just if briefly, this is it. I would be happy to answer your questions, if any. We will be always happy and open to cooperate with you, to share experience with you. Thank you very much, Tatiana. As a matter of fact, it's quite interesting. I was listening to you and I was recollecting how much creativity was produced and will be produced actually to ensure that people would not be left without any support and care. And you have actually demonstrated, and you keep demonstrating, quite amazing creative results. Before we're getting down to the final part of our discussion regarding what is ahead of us and what kind of needs or demands would be relevant to us next year, I would like to discuss a little bit the issue related to financing brought up by Yulia Bogdanova in the chat. I would like actually to formulate it for our English-speaking colleagues because it's addressed to them regarding financial support provided by the government. So at what level was the decision made? Local, regional, or central level? How did it all happen? And whether some commercial or financial indicators were taken into account, maybe some sort of salary scales in the NGOs, or maybe consumer price index, or they just distributed or allocated whatever that was available to them. How did it all happen? The mechanism of all this. We have a question from Daniel. And then I will ask Victoria and Martin to answer this question, how it was handled in Germany. Daniel's question, how it was in France. The decision to provide assistance to the NGO was made by the government. It is funded by the government, to some extent by the EU. Probably it applies to Germany as well. And the European Assistance Fund is 750 million euros. It is focused on actually providing some support to compensate some loss of activities, and there is some special purpose support program for the homeless, for instance. In this instance, there was additional amount allocated in order to gain more financial resources. And again, it is funded by the government. There was additional support to the nursing houses to enable them keep working during the pandemic. That's how it was handled in France. How was it done in Germany? Who would be ready to answer the question? Victoria, please go ahead. I think that I will start and then Martin will contribute. Yes, the decision in Germany was made right away at the federal government level, right away. Federal or land authorities could actually make their own decisions regarding how to provide financial support on the ground. There was no, fit-for-all approach. I cannot talk about the NGOs in general, but as for enterprise and institutions or NGOs which provide support to the ill or elderly people, it was of course up to the government level decision. That's why it could not be actually cascaded downward to the federal level, to the land level. But I think that we, Diakoni and Caritas, we are supported by the churches, evangelical and Catholic churches, at the federal level and at the land level. And we are respectively cooperating very closely with our church in Hessen, Evangelical Church, and there are special funds to provide support to, for instance, outpatient sector, providing support to the elderly people and those who need care. Victoria, do you happen to know when the decision was made, when the calculations were made, what was the underlying economic foundation for that? Now, for instance, during the second wave, when the institutions were shut down, I'm not talking about the NGOs, it's about SMEs. Most likely our Minister of Finance actually articulated an amount by saying that if everyone makes use of the financial aid resources from the government, we will account for about 11 billion in Germany in the form of the state support to the enterprises during the lockdown period. How did they make calculations? I don't know. I think it's up to the level of the financial minister, probably Minister of Finance. Made a decision. Probably there are some resources or techniques and financial considerations, maybe tax-related funds, which are provided for to address this kind of situations. Thank you, Victoria. Martin, do you think you have anything to add?
Yeah, probably one more information about this church, this amounts given by the church. So in Germany, we have a system that everybody who is a member of the Catholic or evangelical church pays taxes when he or she even pays taxes to the government. And so this is quite a solution for the NGOs belonging to the big churches, Catholic and evangelical church in Germany, but the income, the tax income of the churches will become less as well, because it's directly fixed to the state's taxes income. One example for about we at Caritas here in our place, we will have an amount for the whole Caritas of 7% of our ITA is financed by church taxes. So we do not experience any difficult solutions by the federal government within the next years, because next year we will have elections, federal elections in September, but we're a little bit afraid that the hard decisions will come after the next elections. So everybody's waiting for October.
Понятно, да. Хорошо, когда выборы.
Sounds clear, okay. I see a comment from Maria in the chat that in Denmark, the Ministry of Health provided special purpose fund for the organization, and organizations were welcome to submit their applications. In Russia, there were also additional programs conducted, and measures of support were provided. But unfortunately, they were not actually available to all NGOs, but only to charitable organizations or to organizations which happened to receive some support from the state. But nevertheless, there is some sort of financial support provided by the government. I see a raised hand. Let me give the floor for a very brief intervention. I don't see a hand. Antonina Dashkina. Antonina, did you want to say anything? Please, just a few words, very briefly, if you may, because we are supposed to finish in 15 minutes sharp. And we would like to probably give the floor to every speaker, maybe to share their forecasts during a minute or two regarding what is in their view to be particularly important and what we should fight for next year, so that our people who we're working for would gain our full support. Antonina, are you going to say something? Antonina? Okay, while you're getting connected, or maybe you will write something in the chat box. Let's actually talk about the next year. What is the most critical think for us next year? Anna, would you like to start, please? Let me just reiterate what we believe as an important thing for us to be next year. First, to develop the mechanism of providing support to terminally ill people at home. Everything which is related to visiting nurse care and volunteers providing support at home, and tools and mechanisms of support to be provided to the family members who look after their terminally ill people. The second thing is how to develop all the means of assistance in the regions. And I'm talking not only the medical institutions, but on the NGOs as well. Those who work with the terminally ill people in the regions. And we take as one of the priorities for ourselves is how to develop this kind of network of partnership non-commercial organizations to share experience and to enhance quality of palliative assistance. Number three, how to prevent emotional burnout amongst medical staff, because the COVID-19 pandemic imposed additional workload on the medical staff, including doctors and nurses, and we need to come to think of how we are going to provide support to staff in hospices and palliative treatment. Number four is how to continue developing volunteer movement and to restore a balance between medical and non-medical assistance in hospices, because we see some backward trends in this regard. Okay, thank you very much. Same question is to Maria. Maria, are you with us, or have you left us? Please, if you are with us, just please turn on the webcam. Thank you. What is going to be priority number one next year?
Can you hear me?
Да.
Yes,
Thank
yes, we can hear you.
I think the priority should be next year that we upgrade the skills of older people and their capacities in using technology in order to be able to still be active and participate in meetings or in conferences or what digital study tools or whatever may be offered. I think that is one thing that is very important, that we upgrade the capacities of that among the older people. Of course, a lot of other things, but that's what I'll focus on now. Thank you very much.
Спасибо большое.
Thank you very much, Maria. Daniel, are you ready to give us an answer? What do you foresee priority number one in France next year?
Я думаю, как сказать, большое спасибо за эту.
I would like to thank you for the meeting. I think that we need to continue sharing our experience. I hope that, and I think that 1921 will be better than 1920. Thank you very much. Thank you, Martin, Tatiana.
Well, I think that
Yes, it's Martin. Okay, yes.
Oh, sorry. I just can wait for
Go ahead, Martin.
Okay, so I think a very important task for the next year will be to fix an awareness of national and international solidarity comparing to the COVID-19 crisis, because in Germany, but even I think in other countries, we have the situation that the right-wing organizations and parties try to use the crisis for their own politics, and this is a very dangerous situation for the whole society. And I think it's important to get more information about the experiences of other organizations, of other people on a national and international base. And that's why I was so glad to join this meeting today, because it's important to stay in contact. And based on the new situation, we have technical solutions now, like Zoom, we can use. Nobody knew what Zoom was 2 years before. So I think this is very important to stay in contact, because COVID-19 is a problem of all 200 countries in the world. Maybe with the exception of North Korea, I don't know, but every country is fixed by and is hit by this problem. So we have to stay into contact. Thanks a lot for the invitation.
Спасибо большое. Да, Татьяна.
Thank you very much, Tatiana. Yes, I would support Martin. I also think that it's extremely important, actually, to maintain this mechanism of sharing experience amongst the organizations from various countries. Downside Up is a member of the association, European Association of the Down Syndrome people, and we very often keep discussing how to provide support to families. It's always very important for us and very useful, and we always find something to learn from our colleagues. Second thing is, Elena Topoleva has mentioned at the very beginning, is to provide support to digitization of services provided by NGOs, and actually support to NGO in setting up the digital resources and tools for families to enable families to gain support regardless of location of their residence. And it's important to provide support not just to those who will create it, but those who will make use of those. In other words, we need to provide support to regional non-commercial organizations in this process. Number 3 is support to NGOs and arranging in-person service provision, because we do understand that life goes on and individual support provision programs should continue to develop. And it's very important for us actually to be in full compliance with the requirements imposed on us by the authorities in terms of meeting the sanitation requirements, and which applies to provision of additional office space for NGOs, because we are aware of the problem when there are many instances when the NGOs have only very limited space for their operation. And this is the point where big flows of beneficiaries and benefit providers get together. And actually, it is quite possible, and in accordance with the decision made by the city authorities, actually, many NGOs were provided with additional office space, and it was quite a substantial piece of support. Hopefully, it will continue developing, and there will be new opportunities provided in this regard. Victoria? I will certainly join my colleagues when they say that we need to develop the system of communication amongst the countries. And I have a practical recommendation. Maybe we need to get together depending on the areas of activities or specialization, because there is something to learn from Anna, for instance. If I refer to her experience, there is a very well-developed system of providing palliative services in Germany. I think that it might be quite interesting for Anna to learn more about the concepts and practical operations of these institutions, as well as the system of providing long-term support to the elderly people and to the terminally ill people, which is, there is also quite a strong and well-connected network of providing home-based services or services provided to the elderly people in the nursing houses or other institutions. I think it would be a more a practice-oriented solution. And of course, as Anna Hoffen indicated in the chat, that Russia-German dialogue is available and it generates certain results, and certain experience has already been collected. We need actually to keep developing and to introduce these digital technologies. And we need to actually take advantage of the availability of this forum as well. Of course, we need to stay in contact and to share at various levels in various areas of interest and activities. Whether it is to be at the country level or maybe just individual organization level. Thank you very much, Victoria. Colleagues, I would like to thank you all. I think that our today's meeting is just another piece of evidence that indeed the challenges faced by NGOs are to a larger extent very similar. We all face very similar challenges and formulate very similar objectives, and it's important actually to share our experience. Thank you for actually highlighting this, and thank you for not just sharing your experience in how you work and everything. It's not just, of curiosity for us to listen to about other kinds of experience, but it's important for us from the professional perspective. Indeed, it's quite a pity that we have just touched upon it and we have just seen the tip of the iceberg. And indeed, we need to keep in touch with all kinds of organizations in all countries. We all need it. It's important for our beneficiaries, for our society at large. And I hope very much that the new initiatives discussed would not be adopted in the form they are presented now, and there won't be any additional barriers for all kinds of organizations to keep sharing their experience and continue efficiently working. I would like to thank all our speakers for the very interesting presentations and interventions. I would like to thank you for the questions. I would like to thank Konstantin, our translator, for facilitating our communication today. And I would like to actually congratulate you on the upcoming holiday season. And I do hope indeed that the next year would be better than the current one and that we will make it. I know for sure that the society in general will make it, and the NGOs are a very powerful strength, which is a part of our human society at large. And let's just wish good luck to each other. Thank you very much and see you next time.